Good evening to one and all. So I am Dr. Suman Kalyan. I'm a medical oncologist. I practice at Miyot International Hospitals, Chennai. So today I'll be talking about head and neck cancer. So what is this head and neck cancer? It's supposedly the commonest cancer for men in India. So that's how important this topic is. So coming to cancers in men, this head and neck encompasses structures below the skull and above the neck. So all these put together is called head and neck cancers. Why we put them together is their etiology, that is the cause of all these cancers, is the same. The treatment is almost the same. So that's why we encompass all these head and neck cancers into one. So what is the incidence? The impact of this is in the year 2020, we had 14 lakh cancers in India. And among these, most cancers in men belong to head and neck cancer. And it's important to know that even in females, the head and neck cancers has been increasing. This is one of the causes being the incidence of smoking being increasingly common in women in India, sadly, and also the use of smokeless tobacco. So that is also common. So all these contributed to the increased incidence of head and neck cancer in the country. So the health impact for this head and neck cancer in India is that the 66% of all the head and neck cancers present in the later stages, that is in stage in which the cure is not very easily possible. And it creates a burden for both the family, for the self, and for the country, because the expenses are going to be high, the cure rates are not that fruitful. So 66% of people end up in that stage. So that's why we have to know about head and neck cancers. So next, coming to the important question, what causes head and neck cancer? I'll tell you what doesn't cause head and neck cancer. Apart from the causes, the commonest causes being tobacco, the thing that doesn't cause head and neck cancer is familial. Most of the whenever we talk of cancer, we talk about inherited cancers, that is cancer that runs in the family, that that is inherited. So head and neck cancer, interestingly, is not an inherited cancer. It comes due to our own personal habits. And more importantly, head and neck is a preventable cancer, because once the habits stops, once you put an end to the habits, namely tobacco, 90% of cancers is attributable to tobacco. So it's basically a preventable cancer. So why I talk so much about tobacco is that whenever we talk about tobacco causing cancer, we always think about smoking. But interestingly, in parts of India in which smoking is not very high, those parts also have increased incidence of head and neck cancer. This is because we always forget about something called chewing tobacco. So all this pan, gudka, whatever we chew as tobacco, that is as good as smoking to cause cancer. So that equally contributes to cancer incidence. So it's not like smoking alone causes head and neck cancer. So that's one point I wanted to stress upon. And this is about the causes of cancer. Now coming to how do we prevent cancer, it's obviously we have to avoid tobacco. So avoiding tobacco is the first step towards preventing head and neck cancer. It's a very dangerous cancer. Once it comes, it mostly kills. So 50% of people lose their lives to head and neck cancer when the cancer arises in them. So the best way to prevent head and neck cancer obviously is to avoid both forms of tobacco, smoking and non-smoking tobacco, that is chewing tobacco. And the other way is awareness and good oral hygiene. So if your oral hygiene is good, and as dentists would advise, we have to take an annual dental checkup every year. So this will prevent this cancer, even if it arises, from going to a later stage and then diagnosing. So that is prevented by annual dental checkups. And as I told you, awareness is very important. So that's why we do these campaigns, awareness campaigns. So once awareness is there, we tend to reduce using tobacco. For example, year 2021, there was more of litigation. The tobacco practically was not available in shops due to lockdown. The incidence of smoking drastically came down, both in students and working population. So this is where the law comes in. But As I tell you, smoking and tobacco chewing is more of a personal habit rather than depending on litigation, because litigation is difficult in these, both smoking and not smoking, because the tax levied on these is very high. It's difficult for us to expect the government to ban them very soon. So it's our own personal, it's in our own hands that we prevent this cancer by way of awareness and prompt de-addiction. So many de-addiction programs are available in India, even free of cost. So we have to enroll ourselves promptly in de-addiction programs and try to stop this tobacco habit, which in turn prevents head and neck cancer effectively in 90% of people. And this is about prevention and causes. Next, coming to staging. How do we stage cancer? As in any other cancer, the staging of cancer consists of stage 1, 2, 3, and 4. Stage 1 cancer is almost 100% curable, but sadly we don't get stage 1 cancers that common, because people don't realize they have cancer at stage. That's why I always tell about prompt referral to a doctor. So stage 2 and stage 3 are more commoner, in which cure rates are about 70%. And stage 4 cancer, when it comes, it's not treatable, it's not curable, even though it is treatable. So once stage 4 cancer, we land in stage 4 cancer, it's only about prolonging survival and maintaining a good quality of life. So that's how bad the head and neck cancer is. Now, coming to treatments, how do we treat this cancer? Initially, head and neck cancer, as in any other cancer, was treated with surgery, but surgeries were very extensive, especially when the cancer arises below the oropharynx, that is neck, larynx, in which we have an important function, namely voice. So voice will go when we do extensive surgeries. But then came radiation. So with the advent of radiation, many radiation techniques, voice preservation came into being. Now more of voice preserving radiotherapies has been performed, and with radiation we do give chemotherapy either weekly once or 3 weekly ones for about 6 to 8 cycles to enhance the effect of radiation. And for stage 4 cancers, which are incurable, or cancers which come back, that is recurrent cancers, or metastatic cancer, that is cancer that's already spread to elsewhere organs, we give chemotherapy for them. And the more recent modalities in cancer treatment is one is targeted therapy, in which we have molecular targets on the cancer cells, which we give treatment. So it is same as chemotherapy, but the side effects will be minimal. And now recently we have immunotherapy. So it enhances the immunity of the body towards cancer. Specific immunity to cancer is enhanced by giving immunotherapy. It's very effective and of course without side effects. So these are the newer modalities of treating head and neck cancer. But again, as I tell you, the treatment part of cancer is very costly. I cannot say no to that. It is costly. The wiser man will decide upon prevention rather than treatment, because prevention is more effective, and it's going to cost very less. But treatment is just the opposite. It is more costly, and the results may not be fruitful if the stage is very high. So in Tamil, we call it Varumun Kapom. Prevention is always better than cure. That's why you go ahead with this awareness campaign. So this is all about head and neck cancer that I want to convey to the people here. Thank you.